Currently, I am the acting chair of the MRI program at NATE. I've been in this role for almost a year and a half now. I've been working with NATE as an instructor since 2016, teaching between both the MRI and MRT programs as I'm dual certified. Every day is a unique experience at NATE, and working between the office, classrooms, labs, and clinical visits keeps you engaged, which is despite the COVID-19 pandemic is still happening online or virtually. I am an internationally educated technologist. I've completed a degree program and I was trained in and practiced both radiological and magnetic resonance imaging disciplines for almost 10 years. Then when I moved to Alberta, I decided to register my radiological discipline first. After I started teaching at NATE, I registered my second discipline in MRI and took the opportunity to work with both programs. However, this meant I had to go through the registration process twice and write the CMRT exam for both radiological and magnetic resonance imaging. This is an excellent question. In my opinion, the two specialties have a lot in common, and professional development is a rewarding challenge. Although sometimes I might feel putting additional efforts to stay current and up to speed in both specialties, this broadens my knowledge and expands my portfolio of professional experience. I graduated from Jordan University of Science and Technology. As a fresh grad, I joined the specialty hospital back home as a junior technologist. I practiced in general X-ray, fluoroscopy, and OR. Also, I was trained in CT scan, and I started doing cardiac CT angio studies. Furthermore, my rotation included MRI shifts as well, which helped me to build my experience steadily. After a few years, I decided to move to a new hospital where I worked as a CT and MRI technologist. Then I was promoted to a senior position before taking a leadership role as head radiology technologist. Also, I have a working experience in ESWL, or extracorporeal shockwave lithotripsy, and BACS administration. Finally, I moved to Edmonton and joined NATE as an instructor. This is how I got to where I am today in a nutshell. So far, the most significant milestone in my career is taking the MRI acting chair position at NATE. I've learned a lot and have grown a lot from this experience, both personally and professionally. There are a lot of changes that happened in the last decade, but I will emphasize the shift from films and darkroom developing to CR and DR. This change increased the efficiency, reduced repeats, and lowered radiation dose while improving image quality. Also, the shift to digital imaging in radiography with the inherent digital abilities of MRI and CT machines was the cornerstone for BACS introduction and adoption worldwide, which further improved the productivity of diagnostic imaging departments. This is a fascinating topic to discuss, and just to mention a few, digital or smart grid software and its use in chest X-ray to eliminate the effect of scattered radiation without the use of a physical grid is exciting. And in the MRI field, the development of flexible RF coils and faster MRI scanning techniques will improve patient experience and increase productivity. In my opinion, AI, or artificial intelligence, is the next significant innovation, and I think it will help supercharge many aspects in the field, such as safety, efficiency, accuracy, and sensitivity, not only in the MRI, but in all other modalities as well. You have chosen a great career that is dynamic and continuously evolving. Patient care is rewarding in itself, and your work is essential in all aspects. I have a quote for you. One person can make a difference, and everyone should try.